Hey guys, my name's Sam and welcome to Prep Medic. This week's video, we're talking about passing off care to EMS crews or flight teams. So this video is largely based on my own experience. I've been in flights for about 4 years, EMS for about 12 years, and I still pick up shifts on the ground here and there. So I get care handed off to me regularly, whether that's Joe Schmo that has a family member that got hurt that's telling me what happened on the ambulance, or an EMT or a paramedic handing off care to me on the flight side. I've seen the really good and the really bad. Now this list is far from all-encompassing. Everybody's gonna have their own preferences. Every region, flight team, EMS agency is gonna have their own things they want. So I really tried to keep this in general strokes, but I think a lot of the concepts we're talking about today really kind of cover a broad range of things. So one of the first things to consider when you've called for help and you're going to be passing off care is understanding what point A is and what point B is and how you can facilitate that. A couple examples. You've called 911, grandma's fallen in the bathroom, and they're coming to get you. Is that front door locked? Can you go down, unlock that door to anticipate those first responders arriving on scene? If you have dogs out, throw them in the back room. They might be the nicest dogs ever, but we don't know that. So it's just helpful and peace of mind for everybody if they're behind a closed door. Especially if people are really sick, dogs pick up on that and they can get kind of a not so great energy on those scenes. So just having them behind a door is great. Along those same lines, if the patient's ambulatory, if it's something that's not going to, hurt them, or you're confident in walking them out, walk them to the front room. Get them somewhere that it's easier to access. Especially, if they need just a little bit of support and it's going to take a second, it's just going to save time and backs in the long run. Obviously, don't do this if you're worried about injuring them further, or if you think they might fall on the way. You can absolutely wait for professional help. Now, if you are an EMS crew anticipating the arrival of a flight asset, one thing you can do is start anticipating their care pathway. What's going to have to be done before they get in that helicopter? So in this hypothetical scenario, let's say you don't have access to, RSI or blood products. Do you have a blood Y? If you can spike a normal saline bag on a blood Y, get that ready, it's going to save a ton of time, because now to administer that blood product, all I have to do is spike it and flow it and we're ready to go. I don't have to prime tubing. Sounds small, but it actually saves a lot of time. Same with rapid sequence intubation. Even if that's not in your protocol, having an understanding of how that is facilitated and understanding what patients meet the criteria for it are going to help you prep us. So can you start pre-oxygenating them? Can you throw them on CPAP or a high flow mask, high flow nasal cannula? Can you get the equipment out for that RSI? Do you have the medications? You're waiting for a second medical provider on scene to do it. Can you draw all those up or do those med calculations? Those are all things that are very service dependent, depending on who you're working with, but it's definitely something to consider. And if you are working with flight crews, you can ask them exactly what they like to see when they show up at your ambulance. As far as the information handoff, this changes a lot depending what region you are. I personally really like to get the demographics written down. So that's first name, last name, spelled correctly in legible handwriting, and then their date of birth. Sounds like a small thing, but I'm able to look that up in Epic on my phone. We are also able to pass that off to the hospital, and that's important information for everybody to have at every step of care, even if it's just referring to the patient's name while we're treating them. Now, in addition to that, if you want a little bit of history, obviously we like to know a brief rundown of what's happening. I don't need to know what happened in the 70s that led to this, but kind of a what happened today to prompt you to call us. You can get a sample history. So a sample history is a very basic assessment with just a couple relevant pieces of information. First and foremost, it's signs and symptoms. What are they? When did they start? Do they have any allergies to medications? Are they on any medications? What past medical history do they have? When was the last time they ate or drank anything? And then finally, what were the events leading up to this incident? That's really going to cover the majority of your bases. And honestly, at 3 a.m. when I'm interfacing with you, that's probably all I can store in my head. If you can write it out, great, but a verbal report with those pieces of information is also very, very helpful. I do have a complete video that talks about a lot of different assessment acronyms, and obviously you can expand on that. But again, SAMPLE is something that's used in EMS as well as nursing and physicians. We all have our own little take on it, and that's going to help immensely. The next 2 points kind of go together, and that's putting your ego aside and also not making excuses for whatever's going on. We understand that a lot is happening in these situations, especially if you're a layperson and this is a loved one that is sick or hurt. You might not be totally thinking straight. It's going to be hard to keep on one track, and you've got a lot of different things going on around you. We get it. So when we come in and we ask something like, hey, did you get a blood sugar? Or do you know this piece of information? Even if it's something that you think you should know, don't feel bad if you don't have that piece of information. We're asking because it's going to save time down the road. It's going to keep us from having to run another test or something like that. But don't feel like you have to make an excuse for why you didn't have it. If you didn't get that secondary trauma assessment done, or you missed something on the patient, just said, I'm sorry, I didn't get that. And you can kind of move on from there. Now, there's definitely flight crews and there's definitely EMS crews that, are having a bad day, that are going to roll their eyes and do that whole thing. They shouldn't do that, but the reality is that they will. Don't take that personally. Again, you don't have to stammer out an excuse. It is totally okay. We get it. Things happen. So the next part of this is putting your ego aside, and this is way easier said than done. If we are calling somebody else and we're handing off care to them, it's because they offer something that you don't offer. So if you're handing off to an EMS crew, understand that everybody's human, but it doesn't need to be a power trip, anything like that. Work together, talk calmly, and if they're coming in with ego, you still keep that ego in check and make sure you're not escalating the situation. Same with handing off to a flight crew. In our training and a lot of our world, we're kind of taught to come in and take control as fast as possible, and this can come across as abrasive. And I'm not saying that's always the right thing to do. I'm not saying it's always appropriate, but it might happen. So just understand the different worlds we're coming from, and once again, don't escalate that situation. Take a step back and do what's right for the patient at all times, even if somebody else might not be taking the advice in this video. So the last thing I want to talk about is making sure you stay with that patient, unless directed otherwise, until they are fully in whatever vehicle they're being taken away in. Just because you've handed off care, just because they're now directing care, whether that's the flight crew, the EMS crew, doesn't mean that you can't still be of help. Don't get in the way, take direction, but take a step back and just be ready to jump in if they need something, whether that's, lifting help, taking the bags to the ambulance or the helicopter, calming the patient, something like that. There is a fine line here, because I speak from experience where one of the things I hate the most is when somebody's on scene getting in my way, keeping me from doing my job, and just kind of generally fussing over the scene after I've assumed care. However, it is still really helpful to have somebody nearby if I need compressions done, if we need help lifting into the helicopter. Especially in these A-Stars, it's not a pram, we have to lift them in, so we need a lot of hands for that. So just being available but not obtrusive is super important. Also, I have a mind like a sieve at 2 a.m., so I might forget something that you just told me, and I might think of other questions down the road. So it's really helpful to have that person there that I think of a new thing, I can ask them, get the answer right there, instead of playing a game of telephone or sending a runner to get that info from you because you already went back in the house. A lot of these things seem very small in nature. It doesn't seem like a big deal to have that blood tubing hung or to have that door unlocked, but in the grand scheme of things, it actually saves a lot of time and heartache. And I've seen scenes completely fall apart because there's bad dynamic between the handoff of two people. So it can really make a difference for that patient. And at the end of the day, that's what this is all about. Like I said at the beginning, this is not an all-encompassing list. So if you have anything to add, put them in the comments down below. I'll pin the best one up there. It's something that I think is really valuable. If you have any questions, leave them down there as well, and I will see you next week.